Hi everyone, welcome back to session 9, benefits of exercise. This segment will be focusing on specifically the mental health benefits of exercise. Please don't forget to press like and subscribe. Thank you. Hi everyone, welcome to session 9, focusing on specifically on the mental health benefits of exercise. The last segment focused on the physical health benefits. If you did not see that, please go back. They are slightly interrelated. Mental health benefits of exercise. Number one, most importantly, right now, generally speaking, or at any given time, physical exercise is very important for reducing stress level. The stress hormone cortisol, which happens to be very high when we're stressed, is an impediment in terms of sleep, relaxation, general overall health, physically and mentally. So exercise is a great form of alleviating stress. Now, exercise often and in conjunction with some form of medication for people who are suffering from depression and anxiety is very effective. The endorphins, that hormones that are released, dopamine, norepinephrine, and serotonin, are released through exercise. These hormones are the same hormones that are released through anti-anxiety medication. So exercise in conjunction with medication works quite effectively in terms of controlling the symptoms of anxiety and depression. So the whole point of exercise is to release the endorphins, which stabilize mood. So again, norepinephrine, dopamine, and serotonin are the hormones that are responsible for the stabilization of mood. So regular exercise, again, like I said in the last segment, is essential in terms of an actual routine in order to sustain the benefits that you're achieving. So the same hormones that are released through the anti-anxiety medication and through exercise that work together are what are responsible for creating a stabilization. It's an equilibrium where your mood is neither too high nor too low. You're more of at a balanced state. So a lot of people who have chronic pain also suffer from some form of anxiety or depression or both. Generally, they go hand in hand. Therefore, exercise is not only essential in terms of controlling weight gain, but also stabilizing mood. And again, the efficacy of the medications are enhanced through regular exercise. Clear thoughts. Now, if you notice that when you're stressed, when you're anxious, when you're depressed, your ability to think clearly, your ability to have focused concentration is depleted because your stress level is too high. You're anxious, you're panicked. Now, when you exercise, the whole point is to relieve yourself of those intrusive thoughts that you may be experiencing. Now, if you're going to exercise, an hour a day, depending on how you're able to function, depending on your pain threshold, you might get more benefits. However, if you're able to do it for 20 minutes, it might need less at first to start. However, whatever amount of exercise that you do, regardless of what it is, because it's activity that takes you away from negative, intrusive thoughts or anxious thoughts or depressed thoughts, improves your ability to cope. Now, people who suffer from anxiety and depression can also suffer from anger. When we feel a loss of control, when we feel anxious, symptoms of anxiety often can also manifest in anger and aggression, sometimes anger that is displaced. So by that I mean that you're angry about one thing, but your anger is projected onto something entirely different that's unrelated. So regular exercise controls aggression, anger, reduces stress. Also, in terms of weight gain that I talked about in the first segment, people who are suffering from obesity, notwithstanding the physical issues that come with that, mentally, in terms of self-confidence, self-esteem, you might not be where you want to be. So taking a look at how weight gain or lack of exercise is affecting you mentally is also important. So exercising, again, if you're working on a specific goal, improves your self-confidence and your self-esteem as a whole. So people who suffer from ADHD, who take medications such as Adderall or Ritalin, are taking these medications to help improve focus, memory, and concentration. That's synonymous with anti-anxiety and antidepressants, which release the hormones of norepinephrine, serotonin, and dopamine to help keep you at a more balanced state. Now, people who have chronic pain, about 99.9% have experienced some form of trauma in their lives. Now, whether that trauma has caused their chronic pain, whether the trauma has exacerbated, whether the trauma has nothing to do with their chronic pain, the relevance is not important. What is important is that they have experienced trauma. Now, trauma can be divorce, separation, financial issues, an accident, regardless of what it is, something that causes undue amounts of stress. Feelings of trauma and PTSD, post-traumatic stress disorder, can result in feelings of immobilization or feeling trapped, feeling unable to move forward in their lives. So exercise can help alleviate those thoughts, the negative thoughts that kind of sustain those feelings of immobilization and the inability to move forward from the trauma. Again, what I'm suggesting is that in addition to whatever treatment that you're receiving, whether it's in-person therapy, whether it's therapy in conjunction with medication, exercise is a complementary add-on which is essential for dealing with depression and anxiety. It's more effective when it's incorporated into your regimen. So people who are also stressed out, they're anxious and they're depressed can also experience fatigue, mental fatigue. And this mental fatigue often can be alleviated through regular exercise. And I keep emphasizing the word regular. If you're going to be exercising 3 hours one day, nothing the next day, 2 hours the next, this is not a regular schedule. So if you want to see effectiveness and improvement, it needs to be a program that is sustainable. Also, feelings of being overwhelmed. Often when you're anxious, when you're depressed, when you're stressed, when you're tired, you're not going to have positive thoughts. Those thoughts are often going to be negative. They're going to be self-deprecating. They're going to be feelings of hopelessness. Whatever those feelings may be, any form of distraction, which exercise also functions as a form of distraction from intrusive thoughts, can be helpful to control those symptoms. Essentially, also looking at exercise, controlling your weight, nutrition, should be seen as a lifestyle rather than I'm going to lose 20 pounds this week and I'm good to go. The idea of diets, fad diets, little short-term fads do not sustain weight at all. They don't sustain diets. They don't sustain something that can be held onto for the rest of your life. So looking at it as this is a lifestyle goal that you're going to have, which incorporates seeing your doctor, taking your medication, whether you're receiving pain injections, exercising, nutrition, sleep, all encompassing work together to keep you at a level, balanced equilibrium. Thank you for tuning in for the mental health benefits of exercise. Please don't forget to press like and subscribe and join me back in 2 weeks' time for mindfulness and meditation.